Welcome everyone to our National Cancer Prevention Month Webinar Wednesday. I'm going to go ahead and share my screen. Thank you to everyone who is joining us on Zoom and on our Facebook Live. I'm going to share my screen. Oops. Today's one of those days where I have just an impossibly messy desktop, so I do apologize for anything that you see on here. So, okay, here we go. Our webinar Wednesday today is about cancer nutrition and prevention. Just as a reminder, please make sure that you stay muted while the presentations are going on. If you have questions throughout the presentation, we will have some time at the end to take questions, or if something pops into your brain, you can type it into the chat box on Zoom. If you're joining us on Facebook Live, you can type any questions that you have into the comments section, and we'll be monitoring that. And our Zoom participants will be receiving a $5 Amazon gift card following today's session, and I have a couple notes about that at the end. This webinar is brought to you by the University of Chicago Comprehensive Cancer Center's Office of Community Engagement and Cancer Health Equity. And this is our team here. We like to say we are small but mighty, and we try to bring cancer education to the communities we serve and act as a bridge between our patient community and our cancer research community. My name is Aaliyah Poulos, and I work as an education outreach specialist. And I work under Ms. Gina Curry, who's also on our call today, who is our Director for Community Outreach and Engagement. So February is National Cancer Prevention Month. And so today we're going to talk about just some sort of real general cancer prevention strategies, many of which you have probably already heard of or you're already aware of. And then we're going to take a bit of a deeper dive into the nutrition piece with our dietitian who is on our Zoom here. And then we'll talk about some cancer screening guidelines from the American Cancer Society, just to make sure that we have all the right information about when you should get screened for what. So real general cancer prevention strategies, and these were pulled from the American Cancer Society. First and foremost, getting screened for cancer, right? We know that there are lots of different screenings now available for different kinds of cancer. And so just making sure that we are speaking with our physician and are up to date on all of our different screenings is going to be real critical in preventing cancer, but really catching it early enough so that it is, less malignant. Learning your family history and risk factors, avoiding tobacco and avoiding excessive alcohol use, wearing sunscreen and avoiding tanning beds for skin cancer, getting vaccinated against HPV. So our January Webinar Wednesday series was all about cervical cancer, and we learned about how many actually other cancers are also caused by HPV. So that HPV vaccination piece is crucial for preventing cervical cancer, head and neck cancer, anal cancer, penile cancer, and several other diseases. Maintaining a healthy body weight and eating healthy and staying active, which is what Jill is going to be talking about in just a minute. So these are real general cancer prevention strategies, and we're going to take a bit of a deeper dive into the nutrition and screening piece today. So our speaker today comes to us from the University of Chicago Center for Supportive Oncology. She is a dietitian, and Jill Bice, I'm going to go ahead and throw this to you. So I'm going to stop sharing my screen so that you can go ahead and start talking about the nutrition portion of our webinar today.
Okay, one second. Let me pull mine up here.
Great, I can see that.
Okay, good. All right, so like Aaliyah said, my name's Jill, and I am one of the outpatient oncology dietitians here at the University of Chicago. We are available to meet with anybody that's seeing an oncologist here. So even if you're seeing somebody just for prevention or something like that, you're welcome to meet with us one-on-one too. But today we're going to hopefully keep you out of any oncologist offices here. So an estimated 1/3 of some of the most common cancers and 1/4 of cancers overall can be prevented by healthy patterns of diet and physical activity. So while not all cancers can be prevented just by making these lifestyle changes. We can certainly try and prevent some of them. I know I have some patients that come in and are like, I did everything right. I don't know why I'm here, which stinks. We can't prevent everything, but we've got to try and try and prevent some of the cancers, as many of the cancers as we can, by just making some diet and physical activity changes. And most of these are good for not even only preventing cancers, but preventing heart disease, diabetes, all of those other things that you don't want to come in for either. So where do you start, right? Just by saying that seems like a daunting task. So we're going to dive deeper into each of these sections, but we want to get to a healthy weight. We want to be active. Watch how many sugar sweetened drinks we're eating. Watch the meats we're eating. Trying to include more whole grains, fruits, veggies, beans. Watching like junk foods and alcohol. Okay. Breastfeeding if you can. And then watching all those dietary supplements that you see advertised. So those are all going to be things that you can do to just try and keep healthy. And then watching like salt, saturated fat, trans fats, all those things too. Okay. But like I said, we'll go deeper into each of these too. Okay. I just wanted to give you a broad view of what we're going to talk about. All right. So alcohol. Alcohol does raise your risk of getting cancer. It's a recognized carcinogen. A carcinogen means something that can cause cancer. So alcohol can cause cellular damage that can trigger cancer development. The American Institute on Cancer Research recommends no alcohol, none at all. But if you are going to drink, for women, we say just 1 drink per day, and then 2 standard drinks, okay? And what's a standard drink? This gives you a nice little overview here. So a 12-ounce beer would be 1 drink, or an 8 to 9 ounce of malt liquor, 5-ounce glass of wine, or 1.5 ounces of a hard liquor, or like a shot. So 1 of those per day for women, 2 for men, okay? But again, none if you can. All right, second thing, get moving, okay? So being active decreases your risk of getting cancer. Vigorous activity decreases your risk for premenopausal breast cancers. Regular physical activity, it just helps to promote more regular hormone levels so that nothing gets spiked and can kind of trigger any cancers to start developing. And there is some evidence that indicate that people who are physically active have a greater chance of survival. So if you unfortunately do get a cancer diagnosis, if you go in better shape, you have a better risk of hopefully surviving. The American Cancer Society actually recommends that adults get 150 to 300 minutes of moderate intensity, or 75 to 150 minutes of really vigorous intensity activity each week, or a combination of these, okay? It's good to vary up your exercise for sure. And preferably spread throughout a week. So don't just go out and run a marathon on Saturday and call it good for the week, okay? Trying to do things at least 4 or 5 times a week, even if it's just getting in a 30-minute walk. Just trying to keep active throughout the week. Don't just be a weekend warrior, okay? And getting to or exceeding the upper limit of 300 minutes is ideal. So the more the better, okay? It's just going to keep your body stronger and healthier. All right. If you're a woman and you've had a child and can breastfeed, that's awesome for you too. It does help to lower your risk of breast cancers. So your breast cells undergo physical and hormonal changes during pregnancy and breastfeeding that actually offer some protection against the cancer. And then as you're lactating or releasing your milk, the shedding of the tissue and the elimination of the breast cells at the end of that helps to provide protection. And my little plug for breastfeeding too, the part that I like the best is that you burn an extra 600 calories per day. So that's a lot. That can help to get you back to your pre-pregnancy weight too. So like we said too, achieving and maintaining a healthy weight is important. So breastfeeding and burning all those calories can help as well, and also allow for a little bit of extra eating. So like I just said, watch your weight. That's one of the biggest things that you can do to help prevent your cancer. So carrying excess body fat, it does increase your risk for cancers. So that fat tissue can cause inflammation, and that can cause like your cells to have cancerous changes develop, okay? So being overweight and obese increases your blood levels of insulin and related hormones that can encourage the growth of cancers too, okay? So we just really, that's honestly one of the biggest things that I talk to people about is before, if we're just preventing, but also afterwards. So we want, like once you've gone through treatments, we want to make sure that you stay through treatments too, okay? We don't want you coming back. And the biggest thing is to get to and maintain that nice healthy weight, okay? And that's of course easier said than done. Half of that is going to be like that physical activity that we talked about, just staying active as much as possible and increasing your exercise. But the other part of it is going to be eating. So make sure you're eating at least 3 meals a day, okay? I just really think that it's important for your metabolism to be feeding it regularly, right? It's like an engine, okay? So if you feed it like once a day, your metabolism's smart and it thinks that it needs to hold on to that food and store it because it's not going to get fed for another 24 hours. But we want your metabolism to know and think that you're going to feed it again soon. So it can go ahead and burn all those calories and all that fat off, right? So if you're eating at least 3 times a day, then you can, your body will get trained to start burning off those calories and fat. Also, another plug for this is if you wait all day and don't eat until dinner, how do you feel? You feel ravenous. You feel like you could just eat anything. I don't care. Give me all the mac and cheese. Give me all the greasy pizza. But if you've eaten throughout the day and you get to dinner and you're like, yeah, it's probably time for dinner, you're more likely to make a healthier choice, right? You're more likely to choose like a nice, healthy, veggie, full, whole grain, full meal, as opposed to just like, I don't care, get food in me. That's how I feel when I'm starving. So eating 3 meals a day, and I'm a big snack person too. Add in a healthy snack in between your meals. That's going to help you if you can eat it like a small little thing of almonds or a couple, an apple or something like that in between your meals, or a cheese stick or something. Then, and if that's going to help you make a better decision at dinner, then that's a good idea. Okay. So at least 3 meals a day, if not 3 meals plus a couple healthy snacks throughout the day. Okay. And just be present and mindful during your meals. So don't sit in front of your TV. I am guilty of this too, going home from work and just kind of checking out, and just needing to sit in front of the TV with some carbs. So don't do that, okay? Because you're just going to sit and eat because you're paying attention to the TV or you're paying attention to something else. You want to be paying attention to yourself and feeling when you're full, okay? So listening to your body cues. You start to feel full, then stop eating, rather than forcing yourself. No clean plate club here, okay? Let's get rid of that. So if you're full, you're full, all right? And then you don't have to finish your whole meal. It's fine. Save some, put it in the fridge for leftovers tomorrow. Then you don't have to cook as much tomorrow, right? And don't eat too quickly. So it takes a while for your brain to catch up to your stomach. I call it like the Thanksgiving effect. You eat so quickly and then half hour later, you're like, oh my God, I can't even move. So slow down, let your brain have a minute to catch up to your stomach, okay? Because you probably don't need all that you ate at Thanksgiving. If you're just kind of paying attention to your body cues and stopping eating when you're full, that can have a big effect too. And if you've finished eating your meal, but you're still hungry, drink a glass of water, okay? And then wait for your brain to catch up to your stomach. So like I said, it takes a few minutes for your brain to catch up to your stomach. So give that a few minutes And also your brain can confuse thirst and hunger too. So drink a glass of water. Maybe you were just really thirsty. And I use this trick too. If it's between meal times and snack times and you're feeling hungry, sometimes I'm just thirsty. And if I drink a glass of water, I'm good. Okay. So drink a glass of water. See if you were just thirsty. All right. If you're hungry, you've drank a glass of water, you've given your brain a chance to catch up to your stomach, but you're still hungry, that's fine. Then eat, okay? But just maybe grab a half a portion instead, and maybe choose half a portion of veggies instead of going for another portion of the mashed potatoes or the turkey or something, okay? See if you can't fill up a little bit more on the lower calorie stuff. And watch added sugars to your beverages. This is a huge culprit. I have so many patients come in and they're trying to lose weight and they're drinking a ton of juice or drinking a ton of pop, regular pop, or like those frappuccinos from Starbucks, things like that. You don't think about it, but that's a ton of calories, okay? And I like to call them empty calories because they don't give you very much nutrition, all right? It's really just added sugar, added calories. You're not getting very many minerals or vitamins from it. Nothing that your body needs. It's just extras. So sometimes starting there, even if you're trying to watch your weight, just say, I'm not going to get any calories, extra calories from beverages. Start there. Make sure all your beverages are calorie free. Okay. Let me see. And some of those Frappuccino drinks from Starbucks, they're like 800 calories. People don't realize it because they think it's just a drink, but no, it's got a ton of calories in it. So kind of being mindful of that stuff too. All right. Like I said, if you're hungry in between normal meal times, grab a piece of fruit or a vegetable. Okay. See if that'll fill you up. Sometimes if you are really just hungry and not just kind of snacky in meals, put a little piece of protein with that because the protein is going to help to fill you up a little bit more. So like if you have an apple and a seed stick or an apple some peanut butter, that could be a good way to add in a little protein, and that'll help to carry you through to your next mealtime, okay? That protein just tends to stick with you a little bit longer. All right. So, and then incorporate exercise or an increase in physical activity every day, okay? So it doesn't mean you have to go to the gym every day. In fact, right now, I don't know that going to the gym is a good idea at all. But just trying to do something at home, whether it's just going for a walk, or if you're currently not really doing anything, then just more than what you were doing yesterday is going to help, right? So go walk up and down the stairs in your building a couple times, or even just getting up like every half hour throughout the day, just getting up and walking around your apartment or around your house for 5 minutes. That's more than what you were doing yesterday. And then just continuing to try and increase. Hopefully in the next couple months, who knows, the weather will start to break and we can start to get outside a little bit more. Those would be some good options. Or I know at home, I'm not going to the gym anymore, but I've been looking up on YouTube. They have a lot of great videos online, and we've been doing those at home. But like finding a nice yoga on YouTube or a chair exercise video or something like that. And some of them are pretty short, like 15, 20 minutes. So just doing what you can. So even if you're just adding in 10 minutes of exercise, that's more than what you were doing yesterday, okay? And then on that note too, if you have been exercising and you've hit kind of a plateau, maybe you need to change up your exercise, okay? So if you've just been like a cardio queen and just running or just doing the elliptical or something like that, throw in some weights, as long as your doctor's okay with it. Throw in more resistance exercise or just a different kind of exercise than what you've been doing. Your body gets used to that exercise too. So just kind of changing it up. That's why I tell a lot of people, if they've hit a plateau in their weight loss, change things up, shake it up. Your body's gotten used to what you are doing, okay? And I kind of touched on this, just incorporate the changes slowly. So if you've been pretty sedentary and not been doing much at home, don't go try and run a marathon this weekend. Just start with, walking around your apartment every for 5 minutes every hour. Just start there. Walking up and down your stairs a couple times every couple hours. Just start there. It's all going to help, okay? It's all going to get you where you need to go. All right. So the American Institute on Cancer Research for Cancer Prevention likes this model, the new American plate. So we like 2/3 or more of your plate to be the vegetables, fruits, whole grains, or beans, okay? And I like to add a little caveat into that. So this kind of leaves the way they word this makes it sound like you can do 2/3 of your plate as just whole grains. I like to say I need to at least try and wait for almost half of your plate to be non-starchy vegetables if you can, okay? So filling up on those nice salads, you got zucchini and broccoli pictured here. Make sure you're got a lot of vegetables in there. And then we do need grains. So many people, like the keto diet is big right now. Your body needs starch, it needs carbohydrates, okay? But just try and get it from like whole grain sources. So trying to make some swaps whenever you can. So has some brown rice instead of white rice, okay? Or whole wheat bread instead of white bread. Or like if we're doing tacos, I'll do corn tortillas instead of flour tortillas, or whole wheat tortillas instead of white flour tortillas. Just kind of little swaps here and there just to get more whole grains. So whole grains have more fiber in them, which helps to fill you up. It's also good for your GI tract and for your heart. It's also got more vitamins because when we process the stuff to make it white, we remove all the good stuff. We remove the vitamins and minerals and nutrients. So trying to choose more of the whole grain stuff as much as we can, okay? And then make your plate 1/3 or less of animal protein, okay? So watch your meats, okay? It's okay to have it, but a deck of cards is an appropriate size portion of meat, okay? I know my brother gives me a hard time because I have made multiple comments on the size of his steak. But I'm sorry, I'm just trying to protect him, right? He does not need a 16-ounce steak. He needs 3 ounces. So a deck of cards is appropriate, okay? So just kind of watching your portions. And I know so many people are like meat and potatoes people, and that's fine. But just try and reduce it a little bit, right? So even if you don't make your plate look exactly like this tomorrow, if you increase your vegetables a little bit and cut down on your meat portions a little bit, that's better than what you did yesterday, okay? You're still making improvements to your diet. It might not be exactly what this plate looks like, but it's better, okay? You're still cutting down your risk of cancer, okay? All right. And watch your processed foods. Skip the junk as much as you can. I know it's easy. And when you're getting fast foods, if you do, like I know, I get it. I have a family, I'm working, I get it. But try and swap out as much as you can. If you can get a side of like a salad as a side instead of fries, or if you can get your kids the apple slices instead of the fries. Trying to swap as much as you can, okay? And then trying to keep healthy snacks on hand as much as you can. Like if I go grocery shopping on the weekends, if I bring home a cantaloupe, I'll try and cut it up right then because I know on Monday after work it's not going to happen. And the bag of chips is a lot easier than cutting up a cantaloupe after I've worked all day. But if you get home, just before you sit down, chop up your vegetables, chop up your fruits, put them in containers in your fridge as much as you can. Then it's just as easy to grab some sliced cantaloupe as it is to grab the chips. And then you'll be more likely to make a healthier choice. And just like with the vegetables too, if you've chopped up onions, if you have chopped up peppers, things like that, they're easy to grab and throw into your eggs, right? If you don't have to chop it all up, if you've already done that. Then you're adding some peppers and onions to your eggs, adding some nutrients in there. And you've already done the chop up work. I know so many times when I'm making dinner and it calls for a half an onion, I'm so tempted to just chop half an onion. but chop it all, okay? You've already got the equipment out, and put it in a baggie, and then it's there later in the week. You can add it to something that you otherwise wouldn't have, and you'll be getting the nutrients from those vegetables, okay? Red and processed meats. So the American Institute on Cancer Research does recommend limiting these. The biggest risk is going to be to colorectal cancer. So eating too many of these does increase your risk of colorectal cancer. For red meats, we want 12 to 18 ounces a week, okay, or less. So and red meat would be beef, pork, and lamb, okay? So for me and my house, we try and limit red meats to like 1 day a week. I know my husband still really likes it, so we can't get rid of it altogether. But the other days, like last night we did tacos, we did ground turkey instead. So if it's like stuff that has like that would normally call for ground meat, I'll usually swap out for ground turkey, okay? Just to kind of limit our red meat as much as we can. And then processed meat should only be eaten occasionally. So like your bacon, ham, sausage, lunch meats, just occasionally. So once in a while is a treat, you know, my son really likes bacon. So we do get it more than we used to, but we try and make it only like a couple Saturdays a month we'll have bacon for breakfast. We try not to make it a staple. So just occasionally, okay? And then trying to add in a few meatless meals to each week. So they do recommend more of a plant-based diet for cancer prevention, but that doesn't mean you have to be vegetarian or vegan. It just means try and do more meatless meals. So like I know Meatless Monday is kind of a thing on social media. So do a Meatless Monday so that you don't have any meats. Or like if back in the day when we went to restaurants, my husband likes burgers. I would get a black bean burger because they can make it better than I can. And then I had a meatless meal. I got in some more beans that week. Or if I'm getting a stir fry, sometimes I'll get tofu instead of meat on it, just to incorporate more of those plant-based proteins, okay? They've got a lot of nutrients in them, like the beans and the tofus have a lot of really good nutrients for them, and you're reducing your meat intake. So it's kind of a double whammy, okay? And they're usually lower in calories too. So you can kind of save a little bit there as well. All right. And avoid supplements. I know like I get so many questions about what supplements can I take for my cancer? Nothing, okay? Unless we know there's a deficiency, like if we've tested you and we know that like your zinc's low or something like that. Other than that, I don't really recommend the supplements, okay? It's easy to get too much of something, especially when you powder it and put it in pill form, okay? So I have some people that like all these supplements that have like, they're like, well, it's got 15 fruits and vegetables in this one little pill. Well, you don't need to eat 15 fruits and vegetables a day, okay? Too much of something is harmful too. So when they powder it and put it in pill form, it can be harmful. It's better to eat it in whole food form, okay? So we want 3 servings of vegetables every day, 2 servings of fruit every day, all right? So I feel like this is twofold. By telling you to get these 5 a day in, you are going to get in all the nutrients from those 5 fruits and vegetables every day. But as a bonus, you're also too full for the chips and the cookies and stuff. So by eating those nice healthy foods and the foods that you need to meet your nutrition goals, you're also eliminating the junk, okay? So there's just a lot of benefits, okay? In powdering it and putting it in pill form, those supplements are not FDA regulated. So they could be selling you snake oil. We have no idea what's actually in there, okay? But if you're eating an apple, you know what's in there. That's an apple, okay? So there's just a lot more benefits to eating the whole food instead of the supplements. But I think that this is fairly new that the American Institute on Cancer Research actually added this in as a cancer risk, okay? And that says a lot. So just kind of keeping in mind, too much of something isn't good either, and just trying to eat a normal, healthy diet should be enough to give you what you need, okay? All right. So go ahead and hit me with whatever questions you have.
Thank you so much for that, Jill. That was so much information crammed into that presentation. So thank you so much.
Sorry, I feel like I talked really fast.
No, you didn't go too fast. It was just you covered so much. So thank you for that. So someone asked, what about probiotics?
Probiotics are good. I think I take one, and my kids take one. I think that would be a fine idea for you to take a probiotic every day. You can also get probiotics from foods like yogurts or kefir, or sauerkraut, things like that, or fermented foods. But I think of probiotic, I'm fine. Most people, I would be fine with them taking that.
What is, and can you just explain a little bit, I guess, about why someone should take a probiotic, or what does it do?
So probiotic are going to be the good bacteria in your gut. So it just kind of helps to regulate, it helps to make a healthy gut flora, and it can kind of help with bowel movements, gas, things like that, just to kind of get your gut a little bit healthier.
Great. Are you able to speak about prebiotics? I feel like I see a lot about prebiotics and probiotics, and I'm not sure of the difference.
All the probiotics do have the prebiotics in it, but also if you're eating a diet rich in like nice, good vegetables, you should be getting the prebiotics as well. And the prebiotics are what the probiotics feed on. So if you just eat a probiotic and don't have any prebiotics, there's nothing for them to live on. So they have to eat those prebiotics to live.
Okay. I have a question here asking about juicing to get vegetable, to get the, vegetable nutrition. Do you have any thoughts about having your vegetables in a juice form versus,
Sure.
as a whole?
So you're going to be more full if you eat the vegetables in whole food form, okay? When you put something through a juicer, that stuff that spits out that you have to clean out, that's kind of a pain in your juicer, that's all the fiber, okay? So all that fiber, it's really good for your gut. It helps to decrease your risk of like colon cancers, things like that, because it goes through your gut and cleans everything out, right? Because it's so fibrous. So we'd be missing all that fiber if you get it from the juices. Also, if you're doing a ton of fruits and vegetables through the juicer, to get a glass of juice, you do need a lot. So again, it's easier to get too much, but also, you can get extra calories, especially if you're doing the fruit juices. You can get a lot of extra calories because you need like 10 apples instead of just like 1 or 2. Okay. So I do prefer that you eat it in whole food form as much as you can. If you want one small little glass of juice a day, that would be okay. But I would prefer it in whole food form so that you can get that fiber, which is really important for heart health and colon health.
Okay. And then someone asked, what about smoothies then?
Yeah, I was just actually thinking that if you do really want that, I know some people like that type of stuff for breakfast, and that's fine. Smoothies a little bit, you're still going to get the fiber, okay? So you could have like a smoothie for breakfast or something like that. Try and have some protein in there if you're going to have it as like a meal replacement, because if it's just fruits and veggies, you're probably going to be hungry soon. But if you put a little bit of yogurt in there, it'll help. That protein from the yogurt will help you feel a little bit fuller.
Okay, so the smoothie, because the vegetables stay in there and the fiber stays in there, is preferable to a fruit juice, which is where the juice is expelled and all the fiber is discarded.
Yes. Mm-hmm.
Okay, sorry, I just need that. Sometimes that difference is hard to discern.
Yeah.
And so do you have any like tools or apps or something that you think are like really useful for tracking calories or tracking your nutrition intake or your exercise or anything like that?
Sure. I do like the MyFitnessPal app. That one seems to be pretty easy for people to use. And you can track your your nutrition intake and also how much exercise you're doing. Two, if you don't want to use an app, just write down what you're eating. and going back and looking at it at the end of the day and be honest. So really track how much, like, did you really just eat 1 cup, or was it really 2 cups or 3 cups, and did you capture all the little snacky things that you did throughout the day? So be honest, but even just writing it down on a piece of paper can be held accountable. But I do like the MyFitnessPal app.
Yeah, I'll also plug the MyFitnessPal app. I use it every day, and once I start to use it, it gives me an idea of, how much vitamin C is in this thing that I'm eating, or how many calories, or how many grams of fat. You start to internalize just without even looking at the app. Now I know that I can look at this banana, it's 110 calories and it's got this much potassium and things like that, because I've logged it so many times in my app. So
Right.
I will also speak to that I think it's a really useful tool
Yes.
for just tracking what you eat and having an idea of like what's in the things that you eat. They have a really extensive like database of all the different foods. You can scan labels. It's really, I totally am on board with MyFitnessPal. Been using it for a while. Are there any, so I have 2 other questions here. Any foods that you would say you should avoid these, especially when we're talking about cancer and cancer prevention? Are there any foods that you would say, would raise a red flag about things that you should absolutely avoid?
No, I mean, like the red meats and things like that, it's moderation. I think that there's no foods that you absolutely can't ever have again, right? It's just every once in a while and just a smaller portion. Okay, so you can have bacon, but just every once in a while, like maybe once a month, have it for breakfast instead of having it every day. Okay, but I don't think that there's any foods that you absolutely can't have again.
And then, you talk a lot about the different small choices, right? You're not going to get up and run a marathon tomorrow. You're not going to clean up your diet all in one day. So if you were to recommend, if I'm someone who's looking to clean up my diet, but maybe doesn't quite know where to start, like what's the first change that you would recommend that I make, or one easy change that maybe I could start making tomorrow just to kind of put me on that right path?
Sure. So it kind of depends on where you're at right now. If I'm really trying to get myself like back on track, I do eat some fruits and vegetables every day. Am I perfect every day? No. So trying to be perfect every day. Like make it a goal to get 3 servings of vegetables in every day and 2 servings of fruit in every day and 8 glasses of water a day. So just kind of starting there can be a good jumping off point for people. But let's say that that's really unreasonable. Try and get in 2 servings of fruit every day and maybe a vegetable once a day or twice a day. Just trying to make those small goals, even I have patients that I'm like, okay, for this next month, I just want you to eat 1 fruit and 1 vegetable every day and decrease your pop from 4 glasses of pop to 2. Just trying to make those really small changes and then going from there. Okay. So even if it's just adding in 1 fruit and 1 vegetable every day. Okay. That can be a jumping off point too.
I love that. I know I'm someone who will say, I'm going to eat super healthy tomorrow. And then, I mess up a little bit and go, oh, screw it. I'll have the donut or I'll have this or whatever. And so,
right. And just remembering that every day is a new day too, because I have so many people that are just like, oh, I tried, but no, tomorrow's a new day. So like, yes, today the donut's won. Tomorrow they don't have to. Okay. So it's okay.
And I love what you said about, I don't eat perfect every day, but I can start again. I can start and try again the next day. Yeah. I think that's so important for that consistency piece. Are there any foods, you read a lot about like online, like, green tea prevents cancer and like, cancer, quote unquote, cancer prevention foods. And some of them have like, some dubious science behind them. Are there any specific foods that you would say, yes, this, we know that there's good science behind it, that this is a cancer preventing food?
So all fruits and vegetables are good. And we say to really try and eat the rainbow. As far as those go, like the greens tend to provide similar nutrients, reds tend to provide similar nutrients. So I don't want you to just focus on one particular fruit or vegetable. That said, some of the cruciferous vegetables, so like broccoli, cauliflower, cabbage, kale, Brussels sprouts, those are showing some more cancer protective effects than some of the other vegetables, okay? So at home, we try and include those a couple times a week. We don't eat them every day because I want to include other things, but a couple times a week we have like broccoli or Brussels sprouts or something. So that's a good spot to start. Also, you know, some of the berries are high in antioxidants, so we try and include those a few times a week too, which is easy because kids like those. But berries are also a good one. But certainly all fruits and vegetables are good, and they all provide different nutrients. So you don't want to eliminate any or just focus on one certain one. You need them all.
Sure, great. And then I have a question here in the chat. It says, is there an age cap on the protection that you can get from breastfeeding?
No. You mean the kids? Or like
No.
how old the kid is, maybe?
I'm not sure, Judith, if you want to unmute yourself maybe and I'm not sure what.
I don't think,
I'm sorry. I was
told,
I think before that the protection is more for younger women than say older mothers.
No, I haven't heard that, at least. I think it's good for anybody.
Okay.
Great. Great questions. Wow. Any other questions for Jill before we move into talking about some of the cancer screening schedules? If you have any other questions, you can either feel free to just unmute yourself and ask it, or you can drop that question into the chat. And I'm just going to take this time to just monitor our Facebook Live comments just to see if there's any that are coming in through there. Any other questions for Jill? Okay, I don't see any on Facebook Live. All right then, Jill, thank you so much for joining us today, for sharing your expertise with us. It is so appreciated. Thank you so much for always taking the time out of your day to give us some more education on how to eat right and how to live healthily. It's really appreciated. Thank you so much.
No problem. Thanks for inviting me. Have a good day, guys.
Sure thing. Have a good day, Jill. Okay, so I'm going to move in. I'm going to share my screen and just move into the cancer screening schedules. So let's see, time-wise, oh, we're at 1:15, perfect. So the cancer screening schedules that I'm going to share with you today are taken from the American Cancer Society. So, whoops, okay. So again, going back to these cancer prevention strategies, and again, these are probably repetitive for a lot of you, but you know, number one, getting screened can really, you know, make sure that you catch cancer early enough so that it is more treatable. So we talked about these other things. Jill talked about, you know, how to eat healthy and stay active and maintain a healthy body weight. But I want to talk a little bit about these cancer screening schedules. Now, first and foremost, I have to tell you that I am not a physician myself. These are general guidelines for what we consider average risk people. And the one thing, if you take nothing away from this, that I want to stress is that you should talk to your personal care physician, your doctor, to make sure that this is right for you. Everyone is different. We all have different lifestyle factors and different genetic risks that we carry for different cancers. And so it is really important that the schedules that I'm going to talk about today, the screening schedules, are a guideline. They're a general guideline for people at average risk, but you don't quite know if you're average risk unless you actually talk to your doctor about it and examine your own family history and figure out what is going to be the right screening for you. So I can't stress that enough, that the screening schedules I'm going to talk about today are general. They are the general guidelines from the American Cancer Society. And so they may or may not be right for you. And you should absolutely ask your doctor about these screenings and just make sure that you're getting screened appropriately for your health history. So first, for men and women, colorectal cancer screening, there is a new age recommendation that just came out at the end of last year. It used to be that you should start getting colonoscopies at age 50. Now they have lowered that to age 45. So that is the new screening recommendation for colorectal cancer. Colonoscopies are considered the gold standard of colorectal cancer screening. You should get them every 5 to 10 years. And again, that's going to depend on your family history and what your risk is. For people who are at average risk, your doctor will probably recommend every 10 years. And for people who are at a slightly above average risk, your doctor might shorten that time frame to every 5 years. Again, talking to your doctor is the best way to know for sure what is right for you. But the new age recommendation there is 45. As I mentioned, colonoscopy is considered the gold standard, but at-home tests, which are fecal immunochemical tests, FIT tests, or FOBT tests, are a yearly test that you can do if a colonoscopy is not feasible for you. So an at-home test should be repeated yearly. And basically what those do, you have a stool sample that you collect at home. It gets sent to a doctor or a lab, and they detect microscopic particles of blood in your stool that if they're present, they're blood that you can't see with the naked eye, right? It's got to be screened under a microscope. And if there is blood presence in your stool at that level, they'll then recommend that you follow up with a physician for a colonoscopy. So those are the two general types of screening for colon cancer. And again, 45 is that new recommended screening age. For people who are at higher risk, again, if you have a family history, if you know that you have Lynch syndrome, which is a risk factor for colorectal cancer, you may want to get screened earlier, and that's something that you should talk to your doctor about. There is a screening for lung cancer. Now, during Lung Cancer Awareness Month, two of our physicians talked a little bit about this. It's not well known, it's somewhat new, and it's not for everyone. So for men and women who are currently smokers or have quit within the past 15 years and have at least a 30-pack year smoking history, starting at age 55, you may be eligible for a lung cancer screening. And again, it's not for everyone, it's those specific criteria for right now. So if you do fit those criteria, that's a conversation to have with your physician about getting screened for lung cancer. And then the last screening here that is applicable to both biological men and women is a skin cancer screening. So the American Cancer Society recommends starting at age 20 until age 40 that you get the screening every 3 years and then every year after age 40. Again, depends on your family risk. My husband's father and sister both had skin cancer, so he gets screened every year, even though he's in that age 20 to 40 range. So it's really about your own personal risk. And so a skin cancer screening is really just a skin checkup that a dermatologist or a nurse practitioner in a dermatologist's office would perform. They look at all your different moles and things like that you have on your skin and just check for changes from year to year that may mean that there is a malignancy there. So specifically for men and talking about biological men with a prostate, there is a prostate cancer screening starting at age 45. It is a blood test, and it's called prostate specific antigen, or PSA test. And again, it is starting at age 45, especially for African American men who are at a higher risk for prostate cancer. They should speak to their doctor. They may actually even want to start getting screened sooner, but it's something that you should talk to your physician about, again, if it is the right test for you. And then for women, again, biological women, we have breast cancer screenings, which typically start at age 40. Again, I know that I'm like a broken record saying this, depending on your health history and your family history. If you are someone with a known genetic risk for breast cancer, if you're someone with a strong family history of breast cancer, your doctor may recommend that you start getting your mammogram sooner. And so again, these are general guidelines, but generally speaking, it is recommended that women get an annual mammogram at age 40. Women who have dense breasts may also be referred to get an MRI done on their breasts, just to make sure that they're able to catch any sort of lumps in the breast that a mammogram may not pick up. Your mammogram, once you get it, you'll actually get something in the mail saying whether or not you have dense breasts. The This is a new law, at least in the state of Illinois, that you have to be notified if you have dense breasts, and that your insurance company will have to cover an additional screening like an MRI. So again, something to talk about with your physician, but generally speaking, every year a mammogram starting at age 40. And then we talked about this a lot last month for Cervical Cancer Awareness Month, but cervical cancer screening should start at age 25 with an HPV test every 5 years, and that can be done along with your Pap test. And that is it for our cancer screenings. I'm going to stop sharing my screen, and just if anyone has any questions regarding the cancer screenings. Now, again, these are general cancer screening guidelines that I took just from the American Cancer Society, and I'm not a clinician, so I can't answer real specific clinical questions. But are there any questions regarding the cancer screening schedules? You can either drop them into the chat box or unmute yourself and ask. So I have a question here regarding breast screening. It said, talking with some women with dense breasts, some are told by their doctor to get an MRI done and some are not. Is there a standard for dense breasts? And my understanding is that there is not. It will depend on how dense your breasts are. If you are seeing a physician who tells you that you don't need an MRI, or there's additional risks of an MRI that they don't want you to undertake, then you should absolutely listen to whatever your physician tells you. So far as I know, there is not yet a standard, right? Right now we have mammograms being standard of care, yearly mammograms being the recommended screening standard. And there are, like, we talk a lot about, or we plug what we call the wisdom study a lot in these sessions, which is a study that's trying to determine what are the best screening methods, especially for people with different risk factors and different family histories for breast cancer. And so as of right now, there isn't a standard for MRI, but there may be in the future with some of these screening clinical trials that are underway. Great question. Any other questions regarding these screening schedules? Okay, and I don't see any on here. I'm going to check on Facebook just to make sure. And again, if you take away one thing from my screening schedule discussion, it is that these are the general guidelines, and please talk to your physician because everyone is different and not everyone fits into these general guidelines. So make sure that you talk to your physician about your own family and health history to determine what's going to be the right screening schedule for you. And of course, just making sure that you stay on top of your cancer screenings. Okay, so I'm going to go ahead and share my screen again. Actually, I want to just drop the link to our session evaluation into the chat box. So before we move on to our announcements and our raffles, I'm going to go ahead and stop our Facebook Live. Thank you to everyone who joined us on Facebook Live today. We appreciate you spending your afternoon with us, and we hope that you learned something.